Known as the silent killer, abdominal aortic aneurysm is the 15th leading cause of death in the U.S. Scott Stretch, the CAO for Cardiac Services with Eisenhower Health, is here to discuss a much-needed screening service for this condition. Thank you for being here to talk to us about this.
Thank you for having me.
Of course. All right, tell me, what is abdominal aortic aneurysm?
So that's the largest vessel in your body. It's about the size of a quarter. And when that bursts, it can be very difficult to repair. And so we really want to look at doing screenings for that for a variety of our patient populations. The primary category for that are men age 65 and up who have smoked, or women who have a family history of AAA rupture. So we really want to do screenings for those, because if that ruptures, you can imagine how dangerous that can be. When that blood vessel bursts outside of the hospital setting, it has an 85% mortality rate. Whereas you can have a very simple screening done to assess that, and we can treat that before it gets to that point. Unfortunately, across the United States, only 1% of patients actually have the screening performed, even though Medicare pays for it. So we're really trying to raise awareness around this, and if you haven't had a screening done, you should talk to your provider about that.
That's important to know. Medicare pays for something like this.
Yes.
Those screenings are important because you can catch it. There are symptoms you can look for to know if you're at risk.
Yes, so smoking is a really big indicator, as it is with a lot of disease. But you know, that's a very fatal disorder when that happens. And just as an aside, you know, some very famous people have passed away from these types of aneurysms. Albert Einstein and John Ritter both passed away from a thoracic aneurysm, which is a little bit higher up than the abdominal, but it's the same vessel, so you can kind of get the same idea if that ruptures, what that can mean.
Tell me about some of those symptoms. You were saying enlarged, it can look like an enlarged
so basically, you know, the aorta is supposed to be a straight pipe, like a piece of PVC piping, right? So when that starts to develop an aneurysm, we can assess that on ultrasound and CT, and it looks like a bubble coming out the side of that vessel, basically. So instead of it being a nice straight line, it starts to kind of bubble out. And so we want to fix it before it gets to that point.
Right.
And we can, and the surgeons can go in and perform various procedures and put stents and grafts in there to minimize risk of that happening.
Right. So there are some solutions to this. You can do something about this, but all important is that screening.
Yes. I mean, it's a simple screening. It's non-invasive, takes about 30 minutes. Desert Cardiology Center has 4 vascular ultrasound labs that perform this screening. So if you're a patient of theirs, you just tell your provider. If you're not, your primary care provider can refer to that group or anywhere else that does that testing. But get the testing done. And
real quick before we go, congratulations on your 1,000th TAVR. Tell me about that.
Yeah. So around 2017, we began that procedure. It's a minimally invasive cardiac surgery. So we're able to fix your heart valve from the inside out, meaning no chest wound. We make a tiny incision in your groin and we go up through the aorta and we fix that valve from the inside out. That started about a decade ago across the country.
And it sounds like it saved a lot of lives.
Absolutely. I mean, across the country we've done tens of thousands, hundreds of thousands. Those were patients previously that had no other option other than to not have anything done. So we're saving people that had no other recourse.
Right. So congratulations again.
Yes, ma'am.
Amazing that Eisenhower has this option for people. All right. Make sure you get your screening. Call Eisenhower if you are interested in getting your abdominal aortic aneurysm screening.
AAA.
That's right. AAA screening. Thank you so much, Scott, for coming on and talking to us.